Working for Hawaii, you're watching the KHON2 News.
Welcome back. The news of Hawaii's second coronavirus case has many concerned right now with a lot of questions. We have Dr. T, Tony Trpkovski from the Doctors of Waikiki now to join us. Now, Dr. T, are you surprised at all that we've had our second presumptive confirmed case of coronavirus here in the state, or was this something that you expected to happen?
This is something I expected to happen. I think we're going to have a lot more cases, especially once we are allowed to have more testing. I cannot see how we have such few cases. I'm really surprised.
Now, this was an elderly gentleman who had flown to the state of Washington, was on a trip there, had flown back home. He was symptomatic on March the 2nd. On March 2nd, he became symptomatic. On March 4th, he went back to Oahu, and he was taken to a Kaiser urgent care facility where he was not tested for COVID-19 despite his symptoms. Why do you think that could be?
Well, the problem is the testing is not available to us. We have to evaluate the patient and then send, if we deem they're high risk, to the Department of Health, and the Department of Health then makes necessary measures to do the testing. I think once they release the testing to the clinics and the hospitals, we'll be able to control the illness a little bit better, because then we'll know actually who's sick quicker and be able to contain it a lot quicker.
I think a lot of the fear is that we don't have proper testing going on right now.
I believe that's the case. A lot of the physicians and the community are very frustrated because we want to be able to help, and we're kind of have our hands tied about the testing.
Also, that increases death rates because there are not a lot of tests going on within the United States, correct?
I think it's going to help contain the spread if we are able to know who's actually infected and who's not infected. They also will look at the data a little bit better about the mortality rates, because really we're kind of skewed because the mortality rates are based on who we've been testing, which are only the ill. If we tested more people in the community, we'd have a better understanding of the illness itself.
Now, one way to calm people's fear is prevention. What preventative measures can people take to prevent?
Again, just like you guys have been talking about, and I don't want to be a broken record either, washing our hands, keeping our hands away from our face and our mouths. I think social interactions should be limited from handshakes to either fist bumps or no bumps at all. And if we have increased risk factors for getting very ill, which are elderly that have comorbidities such as lung disease, heart disease, have a history of cancer, they're in chemotherapy, they should avoid crowds, they should avoid areas or travel that it puts them at increased risk.
Now, real quick, we only have a couple seconds.
Sure.
What kind of personal protective equipment do you wear? I know a lot of people are concerned about our health.
So when we have a high-risk patient, I wear a mask, I have a face shield, I wear a protective gown and gloves.
All right.
And then we isolate the patients in a special area we have in our office.
All right, thank you. Dr. Tony Trpkovski of the Doctors of Waikiki, thank you so much for joining us and the information.